And two, and
Alright. My name is Caesar Adams, and I will be demonstrating IV insertion via minibag. IV medication administration via minibag. The first thing I will do, I'll get the doctor's orders, see what type of drug is ordered, see the drug type, rate, frequency, route. In this instance, the doctor ordered vancomycin 500 milligrams to be infused over 6 hours. I've already done my calculations, and that's about 14 drops per minute. Now, the first thing I'm going to do is I'm going to add my medication to my mini bag. I'm going to get an alcohol wipe. I'm going to wipe the lid to my medication. After I do that, I'm going to withdraw the appropriate amount of medication from my vial. First, I'm going to insert air into my syringe, inject it into my vial, and I'm going to draw the appropriate amount of medication from my vial. Look it for air bubbles. Next thing I'm going to do, I'm going to add the medication into my mini bag.
No, they're all pre-filled. That's what this one's on here. Yeah. I'll be able to now, but.
Do that. I'm going to discard my needle in the sharps container, but we'll not have to recap it. Some of this. Now I'm going to label the bag with the patient's name, the name of the drug, the frequency of the drug being administered, the dose. Then I'm going to put it on the opposite side of the manufacturer information of the bag. And for the moment, I'm going to go ahead and attach it to the pole. That's already labeled. Next, I'm going to attach my IV to them. This side is still capped and it's still sterile. I'm going to remove, no, before I do that, I'm going to remove this. And actually, I'm going to take this back off the pole. I jumped the gun. I'm going to remove my little bag port. And I'm going to attach this to the bag. Now I want to set the bag on the pole. For the time being, I'm going to fill the drip chamber halfway. Close the drip chamber halfway. And make sure that the solution goes all the way through and there's no air bubble.
I know, I need to go first. Maybe you should go in. I want to see my
There's no kinks in the pole.
Diane. My sergeant said she's not the
That's good. Alright, I'll check my tube. Nothing away. There are no air bubbles in it. I'm going to set my drip rate for 14 drops per minute. Adjust it slightly.
She showed me how good it actually was really easy. My video wasn't as bad as actually.
I have this set to 14 drops per minute.
That's what I'm saying.
My video
I'm going to drape this over the pole for the time being. And I'm going to label my tube
From who?
and the patient's name and the name of the drug.
Are they allowed to do it in here on person? Just for biohazard purposes. I mean, I'll be more than happy to. I'll be more than happy to. If you'll really let me.
Yeah.
Yeah? For real?
I could care less.
Did you hear what it said?
That we're cursing in the background of your
Tube
video.
label. Alright. Now I'm ready to deal with the patient. First thing I'm going to do is perform hand hygiene and wash my hands. I'm going to apply clean gloves. Before I can administer this drug, I have to make sure that IV site is still patent. And I will do that by administering saline to the IV site. I'm first going to assess it and check for any redness or phlebitis.
try before.
That's awesome. I like that.
I'm going to palpate for tendons around the site and make sure this site is still intact. Now I'm going to draw 3 milliliters of normal saline.
He's gonna love me forever now.
Into my syringe. Put 3 milliliters of air in the syringe.
And you look in here to make sure.
It won't cut off.
I'm going
Yeah.
to inject 3 milliliters in of air into my vial. All 3 milliliters of saline. Make sure there's no air bubble.
Okay, and then you.
And then I'm going to remove it.
Hello, my name is
And I'm going to recap my needle.
And then you, as you push it in, you put yeah, you push it back in.
I've already set the site page. Now I'm going
To make sure that the placement's right.
to alcohol sign the patient's arm to make sure it's still clean.
And then you just hook it
I'm
back
going
up
to
to the
attach the
machine.
saline to the
So
INT.
you hook it up to the machine.
I'm going to aspirate.
And then the next.
Make sure it's still flow return, my vein is still patent. And I'm going to start using this push stop method.
So this is like.
I'm going to
See if the placement's right again.
put the saline through the IV.
Keep the color, push it back in, your left.
I'm going to lock the IV down, the INT back up for the time being.
30 milliliters of water.
Remove my syringe
This
and
is the
start
tiny
it.
one.
Yeah, go for it.
Now, now that I've done that,
Push it back in.
I'm ready to attach my tubing to my patient's
Did I
arm.
give a butterfly?
This is
That's better.
So you're saying this is coming in another time or day?
Yeah, you're like.
Just a double check. Even though this has sterile cork on it, but if you say I'll get a fresh swab, swab them both.
Better as far as that, but you can use flavor. Just as long as you.
Attach this to the patient's
You're doing
arm.
it a second time just because it's later that day.
Just read over this and then I'll practice it.
Double check my drip
It
rate.
sounds like it.
Oh, yeah.
Don't want me.
Drip's still good. And with the infusion going. My drip rate's still 14 drops per minute. I'm gonna assess the site, make sure there's no edema, no infiltration. If I were to install a new bag in, I will remove the IV line and put an alligator clamp on the end and drip it back over for the time being. But that's not necessary for this video. If the patient had a PICC line or central line, I would put infuse heparin into the line to make sure the line stayed open. And before I leave the room, I would discard all my appropriate materials in the starch container. I will remove my gloves and perform hand hygiene. I would document how the procedure went and how the patient reacted to the procedure. I make sure the patient understood the procedure, knew everything, and have answered any questions the patient may have had before I leave the room. And this concludes my video.
Oh, it's not her. It's the one that actually wants to do.